So a lot of women have apprehension of getting a mammogram because just of what what it entails in terms of the compression of the breast, and they're worried it's going to hurt, and that in and of itself can deter a patient from getting a mammogram altogether. My advice would be that do your research where you are geographically. Research a bona fide breast imaging center. Typically breast imaging centers that are affiliated with a hospital, they typically have more comprehensive breast care from the point of needing, whether it's a mammogram, like a screening mammogram where you're just going in for a routine, to a diagnostic mammogram where maybe they saw something on the routine mammogram and need to work it up now, an ultrasound, to having a radiologist that's available, oftentimes a breast imaging specialist that can talk to you about what they're seeing, what they're recommending. And then if you end up having to have a biopsy and it ends up being cancer, typically these breast centers that are affiliated with hospitals will have anywhere from breast surgery to medical oncology to radiation oncology, anywhere from a nurse navigator to help guide you in your care. Whereas if you go potentially to somewhere like an outpatient imaging center where there's no affiliation with any hospitals, and there's no navigators to navigate you with your care, patients can be very, very lost of what to do next. So I always say, do your research in your area. See who are the experts, who are known as the experts. Check out their websites. See, do they have an affiliation with a hospital system? Do they have nurse navigators? Do they have breast surgeons and oncologists that all work together for the care of the patient? Because hopefully you will be one of those patients that the mammogram comes back negative and you can move on with your life. But if you're one of those patients that ends up needing additional testing and it ends up being a cancer, you want to make sure you're in the right place and that everything is being addressed in an expedient fashion with a multidisciplinary care team that really works together and puts the patient first.